GatewayC Bitesize, supporting earlier and faster cancer diagnosis, commissioned by the Greater Manchester Cancer Alliance. Prostate cancer. Think A to G. Our specialist is Mr. Sutonye Tolifari, consultant urological surgeon. A. Age-specific PSA.
Consider PSA testing in men who present with low urinary tract symptoms, erectile dysfunction, or visible hematuria. If PSA levels are above the threshold for their age, then refer on a suspected cancer pathway for further assessment. Be aware that PSA may be normal even in the presence of prostate cancer and can be raised in conditions other than cancer. It's also important to mention that many men who have prostate cancer may be entirely asymptomatic.
B. Black men.
Be aware that the incidence of prostate cancer is higher in black males. 1 in 4 will get prostate cancer, and these men are less likely to receive radical treatment.
C. Check red flag symptoms.
Check for symptoms of metastatic disease such as a sudden onset of urinary or fecal incontinence, saddle anesthesia, weakness or numbness in the lower limbs, a new onset gait disturbance, or a new onset of acute back pain. These symptoms may suggest metastatic cord compression or cauda equina.
D. DRE. Digital rectal examination.
Perform a DRE in all men who present with low urinary tract symptoms, erectile dysfunction, or visible hematuria. If the prostate feels irregular, craggy, or hard on examination, refer on a suspected cancer pathway regardless of their PSA level.
E. Exclude UTI.
Be aware that urinary tract infections, as well as prostatitis, BPH, recent catheterization, and/or other urological procedures may all raise PSA levels, causing a false positive result. Please retest the PSA 6 weeks after treating any underlying urinary tract infection.
F. Family history.
A family history of prostate cancer increases risk and should always be checked. If a man has a first-degree relative, so that is a brother or a father, who has had prostate cancer under the age of 55, then that is a positive family history. Of note, if they have another first-degree relative, a sister or a mother who has had breast or ovarian cancer under the age of 50, this is also a positive family history.
G. Greater Manchester Referral PROFORMA.
Please refer all patients using the Greater Manchester Referral PROFORMA. Ensure the patient understands the reason for referral. Include frailty information, as this helps direct patients to the most appropriate investigation or assessment. Please also include the PSA, DRE findings, family history, and any comorbidities or the performance score of the patient.
A. Age-specific PSA. B. Black men. C. Check red flag symptoms. D. DRE. Digital rectal examination. E. Exclude UTI. F. Family history. G. Greater Manchester Referral PROFORMA. GatewayC Bitesize, supporting earlier and faster cancer diagnosis, commissioned by the Greater Manchester Cancer Alliance.